Regular checkup is very important, especially from the age of 25.
So normally we go to doctor only when there is a trouble. People should go to doctor when they are healthy.
How would a diabetic person know that their blood pressure is going up? So, are there any clear signs? Like if someone has diabetes, so they will know, okay, oh, these are the signs, and now my blood pressure is going high.
That's an important question because normally blood pressure is a silent disease. The blood pressure does not cause any symptoms, but you should avoid extra table salts. Like you should not take achar, you should not take chutneys, you should not take papad, and then the Chinese food is very much rich in salt.
One final question. In your decade of seeing patients, what is that one thing you wish everyone understood better about their health? Hello everyone, this is Prakriti and I welcome you all to Heart to Heart, a safe space where we just don't throw medical terminologies about your heart, but actually we talk about health like friends. On today's episode, this is one of those you will be wanting and will remember, as we are calling it hypertension in diabetes, the double trouble. Because honestly, having high blood sugar is tough, but having high blood pressure is very tough. And having both of them together, that's when the real trouble begins. What is the first thing that comes to your mind when I say the word diabetes? Sugar, right? And when I say the word blood pressure, we think about our parents or our grandparents. But what if I tell you these two words, these two diseases are becoming very common in Indian household, almost happening everywhere. And the worst thing, it is happening silently and is very deadly. To answer all your questions, today we have with us Dr. HP,
All set.
a senior expert in managing diabetes and its complications, including high blood pressure. Doctor, we are really honored to have you on board with us today. So, doctor, we keep hearing about diabetes or high blood pressure, but both of them individually, like normally in advertisement or when we are with our family. But no one really talks about both of them happening together. So, I wanted to ask, like, is this a really serious combination together?
You see, ma'am, the blood pressure is a rising problem, and almost our 30-40% population is suffering from high blood pressure. But when it is associated with diabetes, so almost 60-70% diabetic patients, or even more, I will say, they are hypertensive as well. But normally, both these diseases are asymptomatic, they do not cause any symptoms. So people don't get them in a routine thing. So these things are tested in a routine checkup. So when you go for a routine checkup and doctor tells you that you are diabetic, you say you don't have diabetes. And similarly, when examines the blood pressure, so they find that you got blood pressure as well. So both these things are together, and both of them, if not treated well or if ignored, they can be dangerous.
Hmm. So it's like, you are adding fuel to the fire.
Yes, that's absolutely important. You need to go for a routine checkup. Initially, it was advised that we should get a routine checkup done after 40 years. But now we have come down to 25 years because these diseases are being detected at an early stage. So we have started screening patients at early age. 25 now is the age when anybody should get his or her first general checkup done.
If a person who has diabetes and there is also blood pressure quietly climbing up, so how would they know? Like a person is having diabetes, so how will they know that there is also a chance of blood pressure happening? Like, will there any be symptoms or any signs the patient should watch out for?
So this combination is I will say deadly. So both these things they coexist. That is number one, and then they both of them are to be treated with targets. There's a blood pressure target, there's a blood sugar target. So you need to achieve them. But unfortunately, our people, they don't care about them. So they don't have any idea what is the target. They don't have any idea. So what is to be done for that? And they are not health conscious, I will say. So they need a proper teaching. So I will advise every doctor should spend at least 5-10 minutes to teach them, to guide them what is to be done and what is not to be done. Because if you don't treat them, you'll end up with serious troubles like heart attack, like stroke, like eye ailments. So suddenly, sometimes people come to us with complications. So people will come with stroke. So you find you don't know what is the cause of that, and then you find that this patient is having blood pressure of 200, and the blood sugar is also very high. So the first time both these diseases are you see detected when already the damage is done. So you need to catch them early before the damage is done so that we can correct them and we don't get complications. Yes.
So regular checkup is important.
This is a very deadly combination. Yes.
So audience, I would like you all to keep in mind that regular checkup is very important, especially from the age of 25. Yeah, so do not forget that, keep in your mind.
So normally we go to doctor only when there is a trouble. People should go to doctor when they are healthy.
Now, this question, this is something everyone loves to ask. So what is the right blood pressure a person should have? And if they have diabetes, so will the number change? Number one, what is the right blood pressure? And if they are having diabetes, so the number of blood pressure will change, or people say 130 to 85 is okay. So should that be the blood pressure?
Diseases is the number one remedy. So if you don't adhere to the lifestyle changes, so you don't, the medicines will not give you the good result. So like I will say that the patient is obese, for example, if the weight is high and if the weight is not corrected adequately, so the results will not come. So you will have to change the lifestyle. And lifestyle, the most important thing in lifestyle is the diet. So diet is very, very crucial. So especially we Punjabis, when you call them and you tell them that this is to be taken and this is not to be taken, so the next question, you see, they will say, तो फिर जीने का क्या फायदा है doctor?
Very true.
So that is what this is the normal reaction. So that is why we teach them that no, it is not like that. If you eat a healthy life and you reduce weight by 5 kgs on my saying, then you will reduce weight by yourself because you will know what is the benefit of reducing the weight. So similarly, if one is smoking there is no compromise. You will have to quit smoking. There is no compromise in that. There is no question that I'll take one cigarette today and will make it two tomorrow. No. You need to quit smoking immediately. And if you are smoking at home, you are not only producing damage to yourself, but to your family, to your kids, because they become passive smokers. And if you are not exercising, start exercise today. Half an hour to 45 minutes of, I'll say, I normally tell my patients that exercise of your choice. I don't need to tell you what exercise you need to do. Whatever you are comfortable with. If you are comfortable with walking, fine. If you are comfortable with cycling, it is okay. If you are comfortable with doing yoga, do it there. So any exercise is good for health. Any exercise. So, and I'll say the next most important thing in our life which is troubling us is the stress. So that is taking the toll of our health. So we need to learn that we cannot avoid stress in today's life. The life is like that. But then we need to train ourselves that how to get away with this stress. And the best thing I think is the yoga for that. You see, the blood pressure number remains the same. In diabetes, we are very particular that the blood pressure target should be 130 systolic and 80 diastolic, and maybe even lesser. We don't mind that. But for diabetes, we are very strict as far as diabetes, as far as blood pressure is concerned, because you see, if both of them they get together, and then they party and we suffer. And like the most important thing again, I'll say the heart attack, kidney failure, and stroke, peripheral artery disease, and the eye ailments, they come into the action.
And does it differs from your age?
No, age is no more a criteria for blood pressure thing. So that is gone. People used to say 100 plus age is the blood pressure target. That era is gone. Now the blood pressure target is 130, 80 for all age groups. Now we know, now we know that elderly, if they have high blood pressure, so the chances of getting stroke are very high. So systolic blood pressure again, no, age is not a criteria now. You need to stick to one figure, and at any age.
Okay, so well, your lifestyle is very important. You should lose your weight, and sir has already mentioned the methods how you can. But yeah, and blood pressure age is same, like the numbers does not change according to your age. Okay, doctor, now I would like to know if someone has diabetes, okay, and they discover that they also have high blood pressure. So what is the next step? Like they should go for medication straightly, or is there something that can be done to prevent it? Or if no, like they have to take the medicines, can it be reversed?
The medicines are, you see, for hypertension medicines for diabetes, they are very specific. So what normally do our patients do is the first point of contact for our patients is chemist. So they'll go to the chemist. They'll avoid going to the doctor. So the chemist will record the blood pressure. The chemist will check the blood sugar and will give medicine of his choice, without knowing that what medicines are good for this particular patient. So you cannot give one medicine to all patients. There are like few medicines which are to be avoided in diabetic patients. And the first choice of medicines is always ACE inhibitors and ARBs, we call them as. And these medicines are, you cannot give to everybody again. And you cannot start medicines like this. There are few things to be checked before starting these medicines. Like you need to know the renal status. So what is the creatinine level? And then there are electrolytes, the potassium level, which you need to check before starting these medicines, because these medicines, they increase the creatinine level. They are both ways. They correct also, then they increase also. But there are some particular level where you need to. So only I'll say that if you are detected diabetic or you are detected hypertensive, at least you should consult a physician at least, so that he can prescribe you the best possible medicine suited for you, required for you. Not that every Tom, Dick and Harry should give you medicine and you start taking. And one more thing which I would like to tell to patients is that keep monitoring your blood sugar and blood pressure. Normally people say मैं तो medicine खा रहा हूँ मेरा blood pressure control नहीं है. So it doesn't mean that I'll give you medicine and your blood pressure will be fine. So one patient, if you give one medicine, the blood pressure is fine. The second patient needs 3 medicines. Even then the blood pressure is not controlled. So you need to monitor it. You see, we have a data today that there are the hypertensive patients who are taking medicines for blood pressure, or even for that matter for diabetes. So almost 50-60% of the patients, their blood pressure and diabetes is not controlled, even though they are taking medicines. So monitoring is more important. Like people say that to reach at a level is difficult, but to maintain that level is more difficult. So similarly, I will say maintaining blood pressure and diabetes level and continuous monitoring and then adjusting medicines accordingly with the advice of a qualified medical practitioner is more important to keep your health good.
So people should not go to chemist first. They should go to their doctor. Exactly, absolutely. And doctor, will the medicines be permanent for your entire life?
Yeah, absolutely. The diabetic medicines and the hypertensive medicines both. If you are detected until unless if you are obese, like your blood the weight is high, and you decrease your weight to such a level that you don't need blood pressure medicine. So then it is fine if you decrease your risk factor. And we have seen 1 kg weight reduction decreases your blood pressure by 2 millimeter of mercury. That's a scientific thing. So people don't understand this. So people want medicine for this, everything. And even for weight reduction, they are asking for medicine. That is not the right thing to do. Na? Medicines are now, many medicines are available. But if you can do it without medicines, because I tell to my patients that our medicines are not homeopathic pills. No, they are not homeopathic pills that you will take, there are no side effects. Each and every medicine of allopathy has its side effect and needs monitoring. You cannot take allopathic medicines like this.
So again, your lifestyle matters. How you are eating, what you are eating, how you are sleeping, and everything counts. So now let's shift to something which everyone always asks. How would a diabetic person know that their blood pressure is going up? So are there any clear signs? Like if someone has diabetes, so they will know, okay, oh, these are the signs, and now my blood pressure is going high.
That's an important question because normally blood pressure is a silent disease. The blood pressure does not cause any symptoms. Some people say that I get the headache or I get, but that is very rare. Normally, it is very rare for blood pressure to cause headache or some symptoms. There are absolutely no symptoms, and the blood pressure is detected in the clinic by the qualified doctor on routine checkup. So you don't get symptoms. You need to go to the doctor and get your blood pressure checked. Uh, and I would like to say a few words about the blood pressure checking also. Blood pressure checking is not a simple thing.
Okay.
Even MD doctors, MD students have failed because they were not knowing how to check blood pressure. So blood pressure checking is an art. So it has to be checked in a particular manner, and there are few things where we need to see before checking the blood pressure, and what equipment is to be used, what cuff size it should be, if the patient is resting for some time. So all these things, and in a good surroundings, you should check the blood pressure. Yes, of course, there are no symptoms, and the blood pressure is checked only on routine examination, and that is why you need to go to the doctor and get yourself examined. 25 is the age when you start checking your for routine checkup, and if your first routine checkup is normal, supposing everything is fine, then you can rest for 2 years. Then after 2 years, get your checks done. But if there is something wrong, then take the advice of the doctor and then get your whatever is required according to the advice of the doctor.
So, sir, any one message, like your go-to line for any diabetic patient who never checked their blood pressure?
Again, I will say the first and most important thing is the diet. And diet in blood pressure or hypertension, the first thing is the salt. Now we are stressing very much on the salt, and we call sugar and salt as white poisons nowadays. So salt, we recommend salt as 3 grams a day, 3 to 5 grams a day, but it is very difficult to measure that how much salt I have taken, how much salt is required. So the basic for layman people, the answer is that you should take salt as the food should be good. You should be able to eat food. It should not be bland. It should be salty. It should be tasty for your taste. But you should avoid extra table salts. Like you should not take achar. You should not take chutneys. You should not take papad. And then the Chinese food is very much rich in salt. So all these the salty snacks which we take, the biscuits, the bhujia, they're all salty snacks which we take it very routinely and we cherish it. So all these salty things, extra table salts, are to be avoided, and the science has proved it that if you cut down your salt, you can decrease your blood pressure. Again, then your weight is the most important thing, and exercise. And if you are smoking, you need to quit it. And then again, meditation and yoga as a stress buster. All these things together, do it first. If the blood pressure is no control, then medicines, of course, are there to help you.
Well, now I would like our audience to know and take this into consideration that we have to keep ourselves in motion, we have to reduce salt intake, and we should know how to manage stress, and most importantly, our sleep. So, while putting all of these, if taking consideration into these matters, then our health will stay good. Yeah, and even though you are fine, even though you're feeling fine, you have to go and get a checkup, a regular checkup. So, before we wrap, one final question. In your decade of seeing patients, what is that one thing you wish everyone understood better about their health?
The message is very clear and very loud, in fact, that all diabetic patients, whenever they are checking their blood sugar level, they will have to check the blood pressure level. Otherwise, it is half done. So, if you are not checking your blood pressure and the blood pressure is high, even if you control your blood sugars, the damage will be done. So, there are two very, deadly risk factors. So, you need to tackle them together. If you tackle one out of the two, the other devil will do the damage. So, you need to tackle them together. So, whenever you are taking diabetic medicines, so now sometimes we give, the best medicine to protect kidneys in the blood pressure for the hypertensive drugs for diabetes. It is the ARBs and the ACE inhibitors. So these two medicines has to be there. If your prescription of a diabetic patient prescription does not have ACE inhibitors or ARBs, it is criminal. If the doctor is not writing one of these medicines in the prescription, so that means the doctor is not aware what is happening and what is the right thing to do. And then I will go one step ahead that this is a crime if you don't write these medicines in a prescription of a patient who is diabetic and hypertensive both. My message again will be very loud, that is, people take their health very casually, let me tell you. So they have planned for everything, but they don't bother about their health. Not at all. Not at all. And I don't know why they are afraid of these allopathic doctors. They will not go to them. They'll go to the first, like I told you initially, the first point of contact for them is the chemist. So at least take care of your health, yeah, because that is what we are for here. If your health is not fine, क्या करोगे पैसे का? कुछ नहीं बनना. क्या करोगे भाग दौड़ के? And when you go to a hospital in emergency state, then no people know that what is happening. The expenditure goes rooftop and sky high expenditures in hospitals. It is difficult. So better prevent health problems rather than suffering from them.
Okay, sir. So, well, that's the end of my questions, and we were honored. And it was a very insightful podcast, I would say. Lovely meeting you, sir. Lovely meeting you.
Thank you, Ji. Thank you so much. Thank you. Thank you.